In other words, it doesn't cover this drug at all, or it just covers it up
At
to?
all.
It doesn't cover it at all?
At all.
Huh. I'd like to look into it. I don't know.
The drug that it did, the other drug it did cover, I had very bad problems with. So the doctor.
Right,
Well,
right.
we do have your phone number, so perhaps the congressman
Yeah,
and
but
you
you're
can...
my constituent, as you mentioned, so I will definitely follow up and look into it. I don't know why it's not covered, unless you wanted to comment on it further. Do you know the reason?
That's all we know. I got a letter from the company saying we do not cover this drug.
All right, well, let me look into it for you, okay? I'll follow up.
Appreciate it.
Sure.
Hey, thank you.
Thank you, Mary. And perhaps just for other callers on the phone who have problems paying for prescription drugs, our State Senator Joseph Vitale can talk about some of the state prescription drug programs we have.
Thank you, Patricia. We do have, of course, the PAD program, PAD, and Senior Gold. There are opportunities for seniors who are not quite Medicare eligible or have Part B to participate. PAD is for lower income seniors, and the Senior Gold program is for those seniors who earn a little bit more than the PAD eligibility provides. And so it's a great opportunity. You call any of the 800 numbers or call a legislator's office to get access to the information to enroll. But there's always an opportunity for coverage. It's just a matter of cost and how much the participant would have to pay.
Great, thank you very much, Senator. So we have now over 2,700 AARP members who are participating in this live teletown hall, talking about health care reform, the rising costs of prescription drugs, and access issues. We have as our guests Congressman Frank Pallone and State Senator Joseph Vitale, both important individuals when it comes to health care and health care reform issues on the federal and state level. We can move along, actually along the lines that Mary was bringing us. We are talking about the cost of prescription drugs, and we'd like to thank you, Congressman Pallone, for your recent co-sponsorship of a very important bipartisan bill in the Congress, the Access to Life-Saving Medicine Act. Would you tell the members of the on the phone a little bit about this bill and how it will help them?
Yeah, this is the one that deals with. I'm trying to think of you. Why don't you
It's
tell
the
me?
okay. It's
Oh, you're talking
creating
about
a
the
path-
biologics bill. Okay, I get confused with those
I'm
names.
sure there's a lot of issues out
That's
there.
all right. It's the generic biologics bill. Well, I think many of the people on the line know that for a number of years now we've had generic prescription drugs for what we call chemical drugs. In other words, those that are basically made using a chemical compound, and generics have been a way for us to really reduce costs, because many times there may be only 20% sometimes of the actual cost of the name brand drug. But there are a group of drugs that are called biologics, basically deal with I guess live organisms, if you will, rather than chemical compounds. Probably the best well-known would be insulin, for example, but there are many others that have not been subject to approval for a generic. In other words, they're just operating under a patent. And if we can take those biological drugs and provide a generic equivalent, we can save a lot of money, because many of these biologic drugs are very expensive. And there's every reason to believe that the FDA can put together a process where they actually approve a generic biologic. And we have legislation, you mentioned the name of it, that would accomplish that. We're hoping that we can move the bill through my health subcommittee within the next month or so. There are competing bills, though, because some people think that the time period for exclusivity, in other words, before the patent expires and you can approve the generic, should be longer than others. The bill that I have introduced only has a 5-year exclusivity period. In other words, 5 years before the patent expires, which is the same as we have for chemical drugs. But others say that it should be longer, and there's another bill out there, for example, that has 12 years. Then there's the whole issue of, are they completely interchangeable, and whether or not the FDA can establish a process, and I think it can. In fact, in Europe they have a process. So we're trying to do this, and if we can, it'll be a major way to reduce costs.
Thank you, Congressman Pallone. And we do know that there are competing bills, and we recognize that your bill is much stronger. It will get life-saving drugs at a cheaper cost to consumers sooner, and that's our goal. So thank you very much for that.
Sure.
Would like to take a live call actually from somebody on this issue of generic biologics and the use of biologic drugs. Maura, are you on the call?
Yes, I am.
Would you like to tell us your story?
Sure. Good morning, and thank you for taking my call. My question is for Congressman Pallone, and it has to do specifically with the cost of biologic drugs, and I'm very glad that the topic has already come up. I'm currently undergoing chemotherapy to help with breast cancer, to help defeat it. And I've had to get an injection of a drug called Neulasta, that's Neulasta, the day after I get my chemotherapy, and that's to stimulate my bone marrow. Now, I've been told that the charge for this biologic drug ranges from $10,000 to $16,000 per injection, and I've had 4 of them. There is no generic version, and from what I understand right now, there is no pathway that allows for the development of generics for biologic. Now, it sounds like the Access to Life-Saving Medicine Act that Congressman Pallone is sponsoring will help to create a pathway for generic biologic drugs. And I am saying go for it, because this is outrageous. If I didn't have private health insurance and Medicare, we would have to pay for this out of our pocket if we could afford it. Otherwise, God only knows what would happen. I probably wouldn't be getting treatment. So I just say congratulations on sponsoring this bill, and please fight with everything you've got to try and get it passed.
Well, thank you. You can congratulate me when we pass it, though, because it's not going to be easy. I think we have made a lot of progress, though, because if you go back a couple of years ago, the drug companies at the time were saying it wasn't possible. In other words, there could not be a pathway for generic biologics. And that is no longer the case. I mean, now the argument is over how long the patent exclusive period would last and, how it would be administered. So we've certainly made progress, and at least there's an acknowledgement now that we can do this. But we will fight, and we'll try to, get it accomplished within the next year or so. But it is going to be a tough battle. But thank you.
Thank you very much.
Thank you.
Thank you very much, Congressman, and Maura, thank you for that call. We have over 4,000 AARP members who have joined the call this morning. Thank you very much. If you're just joining us, you are joining a conversation about health care reform with our federal Congressman, Frank Pallone, and our state Senator, Joseph Vitale, 2 leading individuals when it comes to making policy on health care reform. And we are taking live calls. If you have a question, you can press *3 on your phone to ask a question. Press *3 on your phone if you have a question. I think we'll take a call now from Joseph for Senator Vitale. Joseph, are you on the phone?
Yes.
Okay, great. Can you tell us where you live?
Hello, Senator.
How are you?
Yes, I'm a licensed physician in the state of New Jersey. I practice in Muskegon, New Jersey. I've been there for 35 years. And I think the number one impediment to healthcare costs is malpractice insurance. The physicians of the state of New Jersey are constantly being threatened by malpractice suits. There's been no reform, there's no significant reform. This drives up the cost of health care. 90% of the testing that is done is not in the patient's interest. It's only to protect the doctor against a possible frivolous loss in the future. And until there's meaningful reform,
Right.
we're never going to be able to control health care costs.
Well, thanks, Doc. I appreciate your concern. In fact, you probably remember this. Nearly 4 or 5 years ago, there was when malpractice insurance, liability insurance, which is insurance that physicians pay to protect themselves against any number of things, particularly claims, really spiked. The cost went really through the roof and beyond. And there was a real crisis in New Jersey, and it continues to be a crisis of cost. Fortunately, there are more insurers in the state today than there were a half a dozen years ago, and so and I spoke with the Department of Banking and Insurance, and the costs are coming down slightly. But we need to see more of that, and we need to have more competition. But I think the root of course, is making sure that when there is legitimate malpractice, when there's negligence, and I don't think that any physician in this state, or any hospital for that matter, wants to harm someone. But when a bad thing does happen, and it was preventable, and there was, God forbid, negligence, then the victim, if it's a child or anyone for that matter,